Director, how many people can you detail to this, or how big an effort will this be on the part of the Department of Health?
This
Who are
is
the people, and how will they go about this?
Yeah, this is something that our employees at the Rhode Island Department of Health, and we'll welcome it from other state employees, are honored to have the opportunity to go and support and help make sure, in solidarity, that people who are protesting have the resources they need to be able to raise their voices as safely as possible.
Is this a volunteer effort?
Yes.
This will be starting on Friday?
This will, for the first peaceful protest that we know about.
Brett, can you kind of walk us through some details on what the work share program is going to look like? How many people potentially? I know you said it's voluntary, so.
Right. So the work-share program is voluntary. It's available to all executive branch employees, union and non-union, except for a couple excluded agencies. So anyone that's part of a 24/7 operation, our prison guards, nurses, and direct caregivers in our state hospital, the people on the front line of the COVID response who work for Dr. Alexander Scott, as an example. There are groups that are excluded. Everyone else is included. And we are encouraging volunteers to step forward by Monday. Our target is to see a minimum of 25% and a maximum of 50% participation amongst the included groups. So there's about 8,000 employees in the what we call the core executive branch, which is executive branch not counting the colleges or the other general officers. We think that there'll be about half of those who will be eligible to participate, so about 4,000. So we'd like to see somewhere between 1,000 and 2,000 employees participate.
And what kind of savings do you think you'll
If we get a 25% participation, that's approximately $5 million in savings, and those savings grow with the greater participation. And then, as the governor referenced, we are strongly encouraging our other partners in government, the judiciary, the legislature, the other general officers to participate, and we would accrue savings statewide from their participation as well.
To be clear on how it works, potentially a day or two, a week off.
So the program is a 40% reduction in hours, which means if you're a 5-day-a-week employee, you go down to 3 days a week. You continue to receive your state salary for the 3 days that you're working, and you're on work share for the 2 days that you're not working, which means you receive a federal aid check analogous to unemployment for those 2 days. You also are eligible for the $600 a week supplemental pay that Congress passed as part of the CARES Act through July 31st, and the state saves that 40% of their salary.
So theoretically speaking, could some of these people make more money by opting into the program than if they're working full-time?
So it's a 12-week program for the state, starting on June 15th and ending on Sunday, September 6th, the day before Labor Day. And because of the $600 for our lower wage employees, they will likely actually make a little bit more as a part of the program. For the first 7 weeks of the program, while the $600 is in effect, they'll actually make significantly more than their weekly paycheck. But then for the period of August 1st to Labor Day, they'll make less than their weekly check. But we're requiring participation for the entire 12 weeks so that it balances out. The state's able to maximize savings, and we're able to take care of our employees with we're not looking to necessarily create winners out of this. We just wanted to hold them harmless.
How significant is the $5 million savings?
In an era where we are looking at terrible choices and need to find savings anywhere we can, this is a good start while we wait for news about additional federal aid. We're able to provide an option for our employees without impacting their life economically at a challenging time, and it is a smart and responsible action to take. It's not going to balance the budget, but it's a good start, and it's the right thing to do right now while we wait on more news out of Washington.
What other ideas are you floating right now that might, make up for the other 95 million that we're looking to close here? Anything else besides the federal stimulus potential?
So, as the governor said, if there's no future federal aid, there's no way to balance the budget with an $800 million deficit without having everything on the table. What we've been focused on, and frankly going back now several months, is taking responsible decisions now to stop unnecessary spending. There's been a hiring freeze in place for non-COVID or direct care response workers for several months now. There's been a spending freeze for anything that's not crisis-related for several months now. This is another tool. So we've been taking steps for several months now as we've seen state revenues fall off dramatically to try to take responsible budget-saving maneuvers without sacrificing the services that we're providing to Rhode Islanders and to enable us to still respond to the crisis while we wait on additional federal aid.
Brett, you have a lot of people who are watching and wondering if they're part of this, quasi-publics, things like that, or is that separate?
So the quasis are not included in today's announcement, but similarly, we would encourage them to participate. It's all public dollars, and so if some of our quasi-agencies are going to see reductions in either their federal aid or some participate, depending on what the services that they provide. As a DOA director, I serve on the board of resource recovery. They're seeing a lower amount of revenue because, frankly, we're throwing away less waste because businesses have been closed. And so every either core function or quasi-function of government is feeling the impact of the secondary effects of this crisis. And so this is, we believe, a creative and smart way to save money now while there's a unique federal benefit that can make sure that our employees are still in a place where they can take care of their family and meet their financial needs.
Could the General Assembly or the legislative branch take advantage of this program?
They could. We hope they will. They've been briefed on it, and they tell me that they're looking at it.
Governor, you touched on nursing homes yesterday, and I think you had mentioned possibly looking at visitation again in phase 3. Massachusetts announced today that they're going to start some forms of visitation immediately if you go outside with the resident and you stay a certain distance apart. And you said yesterday that Rhode Island, in certain elements, is doing better than Massachusetts in nursing homes. What's your thinking on that, and does that change at all?
It does not change our thinking, which isn't to say that they're wrong. In no way do I want to criticize what they're doing. I think Governor Baker has his hands full, as do I, and he's doing a terrific job. It's just a judgment call, and we've erred on the side of caution. Almost 80% of our deaths have been in nursing homes. Nursing homes many of them are old facilities. Many of them have shared rooms, shared bathrooms. They're struggling with infection control, struggling with the virus, et cetera. The workers, we hear from employees in nursing homes, they're afraid. So it is not ideal. That I've said so many times. I am almost always faced with two bad options. Option one, enable visitation in some way, which is very necessary for the mental health of the whole family, but I know will cause greater loss of life, for sure. Option two is hang on for a few more weeks, allow us to get a better handle on the infection control in this congregate care setting, ask family members to hang on for a few more weeks, and we just chose that, and we're going to stick with it.
Yep.
I know you were just on the phone a short time ago with other governors and the White House. Can you just give us a little glimpse into that conversation, particularly with all that's been going on with the protests and these large gatherings? I assume that was part of the conversation today as well.
Yeah, actually today's conversation was pretty much on COVID. The Monday was all about the protests, and we've already covered that. Today, actually, to Brian's question, was heavily on nursing homes. So CMS, the healthcare, Medicare and Medicaid director was on the phone and was really leaning on governors to lean on nursing homes to do a better job with infection control, asking us to ramp up our inspections of nursing homes, to make sure they're doing infection control. Every state they went through all the states, every state is struggling with the virus in these congregate care settings. So that was a big focus of the call. A continued push for governors to do more around testing, continued push to look out for our urban communities and communities of color where, like every state, including ours, the test positive rate is high. So today was all focused on the crisis and helping us meet the needs of the crisis.
Were there any talk about another stimulus package?
There is not a call that I've ever been on where the governor, where every governor doesn't raise their hand and say, we need federal stimulus.
At all? I mean, obviously we know where our delegation stands, but what's the White House saying to you?
So my own view, having been on all of these calls, talked to the president, the vice president, Secretary Mnuchin, something is going to happen, is my belief. Now, if I could predict exactly what Congress is going to do, when they're going to do it, then, you know, I'd be some kind of a magician, and I'm clearly not that. But if you're asking me my assessment, I talk to my Republican counterparts around the country all the time. They are asking for a state aid as much as Democrats are. This is bipartisan. I think there is widespread recognition, including by, you know, the administration, that absent an additional stimulus, you're going to see a lot of, you know, much worse economic conditions. So we're in a recession now. Our ability to pull ourselves out of that recession is going to depend on whether they send more aid to states. If they don't, we're going to add to the unemployment rate. We're going to have to start laying off public employees. So, you know, certainly there have been no promises, but it comes up on every phone call. And, you know, the administration has always evidenced their openness to get something done. Look, I think that Speaker Pelosi, of course, I support her bill fully. I doubt that's going to be the bill that gets through the Senate. But on each passing call, it feels that there's a greater sense of confidence that the Congress will do something. Because, by the way, most states have we're up against the clock of a July 1st budget. So I think they're going to do something. I hope they are, and I spend a lot of time pushing for it.
Governor, last night, helicopters in the sky, National Guard vehicles on the street, people see riot sticks and riot shields. As much as people in Rhode Island should feel safe, do you understand why, though, people are on edge?
Of course I do. Of course I do. We all are. You know, in my own home last night, I hear the helicopters. My children hear the helicopters. It is a deeply unsettling time. And I knew when I made that decision to deploy the Guard, I knew the visual that people would see was military-type folks in the streets with riot gear, Humvees, hearing the helicopters. But I felt it was necessary, and I'd rather hear that than what we lived through and what other cities are living through in terms of the riots. So it's unsettling. I hear that. I think it's valid, but it's designed to keep you safe, and it will keep you safe.
You mentioned the big protest planned for this Friday, Black Lives Matter. Have you considered attending the rally?
I haven't thought about it. I certainly support the effort, and I may. You know, it's a challenge for us because we were up here saying no.
You have all this free time on your hands.
Well, exactly, the free time, but like I support the cause completely. We are up here saying no groups larger than 15. So I'm not going to lie, we're in a tough spot on this one. I think I would like to be there, and I'm certainly there in spirit and vocally advocating that we take action to finally get rid of institutional and individual racism. Maybe I will attend on the outskirts to show my support, but I also have to, you know, keep people safe, and I don't want to violate my own social distancing rules.
Governor, I know you met with
repeatedly asked. I'm sorry?
This person.
You've repeatedly characterized the rioters as outside agitators. You said today it was a coordinated nighttime attack. And I'm not saying that isn't accurate, but I've gone through the evidence on arrest records and so on from Providence, and I spent some time analyzing that. And I can tell you that of 60 arrestees, 88% gave Rhode Island addresses, 8% gave Massachusetts addresses, and 3% were unknown. And the makeup of the arrestees, out of 60 arrestees, all but 2 of them were under 30 years of age. 6 of them were juveniles as young as 14 or 15, And that doesn't look to me like a profile of outside agitation. That looks to me like a bunch of, frankly, stupid kids filled with anger and rage, acting with antisocial destruction because they just don't know what else to do. And not to, again, go into a history lesson, but in the 1968 Kerner Commission, President Lyndon Johnson just dismissed the report because that's what they said. They said, this is not an organized effort. This isn't the Soviet plot. There's no one behind this. There's no organizer. It's just really angry people who don't know what else to do and are acting harmfully to the society. And of course, the Kerner Commission also said, just as you have, that violence is damaging to the society. It hurts everyone. But the rioters, of course, don't understand that. And are you, and I don't mean you personally, but I mean the state of Rhode Island, are you making the same mistake that President Lyndon Johnson did in identifying the cause of these riots as outside agitators and coordinated attacks, when in reality they look like they're local people?
So let me say this. We don't know is the answer. So you say you've looked at the evidence. This is an active investigation, and we are still trying to figure out who was behind it, where did it come from. It's an active investigation, and we are trying to figure it out in concert with federal authorities, with all of the intelligence gathering that they can do. You are correct, certainly, that the people who were arrested were predominantly Rhode Islanders. And very sadly, a lot of young people, 14, 15, 16 years old. Here's what we also know. The tactics that were used here are eerily similar to the tactics being used all across the country. So it would suggest that these are not just a bunch of, to use your words, angry kids in Rhode Island who are deciding to engage in this rioting. Having said that, we don't know who organized it. State police is investigating it, and we're going to stay on top of it. If you're saying, and so that's where we are, and my job is to protect Rhode Island, to make sure that it doesn't happen, or if it happens, we minimize physical injury, physical harm, the loss of property, and that we do what we can to deter. This has happened, I think, in 120 cities, 26 states. We're trying to, deter them. I will say this. If what you're saying is that there are a lot of people who feel frustrated and angry because they've been persistently the victim of racism, a racist system, poverty, being left out, poor public education, poor infrastructure, lack of access to health care, lack of access to education, inability to go to college, you're right. And so we need to do more about that. Health care, wages, equality, education. But what I'm talking about now is these were organized attacks on our community. Precisely who did it, we got to figure that out. And we will not stand for organized attacks on our community that create violence and hurt people.
Should they be treated then? I mean, if these are coordinated attacks, should the people charged be treated as part of like a criminal conspiracy? And when I think about that, I think about what Mike just said, which is true, that we're talking about lots of young people. Should they have charges, additional charges added to it?
So that is a better question for the Attorney General, and he has been a great partner to me in this, and he and the state police are working through the investigation. Candidly, the whole country is working through this right now, so you should ask him about his strategy. I will just say this. We need to hold everyone accountable who engages in violence. So if you're in our streets and you're throwing bricks at someone and you're breaking and entering and you're setting things on fire, you will be arrested and you will be held accountable. And the other, his prosecution strategy, I think you can talk to him about.
Are we risking being dragged into an asymmetric conflict, though? Because is there a risk here that somebody posts a flyer on social media that says, oh, we're going to have this big riot at such and such location at such and such time, and we have to send 100 police officers and 100 National Guardsmen? And that's obviously unsustainable in the long term. I understand it's essential now.
No, you're exactly right. So I think we don't know where we are. We, just like COVID, we are in unprecedented times. You know, John just said, like, you have a situation now where we're lying in our beds and hearing helicopters overhead. We are living through this in the first instance together and learning every day. But my job on a daily basis is to protect Rhode Island. And as more information becomes available, then we'll adjust our response.
Governor, I know you met with Brother Gary of Black Lives Matter earlier today. Two questions. One, just generally, if you could sort of summarize what that meeting was like for you. And then secondly, in the context of the recent Ethics Committee ruling, will you commit to at least considering or even fully commit to a BIPOC nominee for the Supreme Court?
So I did meet with Brother Gary. I have a long-standing relationship with him. I have a lot of admiration for him and his work. To be honest, I'm spending a lot of time listening to people in the community, whether it's in my office or on the phone with Black pastors, young people. It's time to listen, really listen, with humility. And what I hear is, you know, there's a mix of anger in the community, but frankly, also just grief and numbness, a desire to be heard. And the people I'm meeting with who live in Rhode Island, like Brother Gary, like others, they say, please don't mistake us for these folks who are coming in and looting. We actually want to make change to bring about, in his case, better health care, better schools, better wages, more equality, affordable college, like opportunity. And so anyway, I'm trying to be present in the community because I think that's important, and also advocate for change. The answer is, of course, I will consider that. I'm actually very proud of my record of diversifying the bench, and I'll wait until I get the list from the JNC and pick who I think is the best. But it's absolutely a priority of mine to diversify the bench, and of course, I'd consider that.